You want the truth? A man can lose his edge long before he loses his hair. For many, it starts quietly. Weaker erections, a little dribble after you pee, the sudden realization that things just don't work like they used to. But here's what nobody tells you. The issue isn't your age, your testosterone, or even your prostate. It's your muscles. The deep hidden ones you've never stretched, never trained, and likely never even heard of. My name is Dr. James. I've spent over 30 years helping older men regain the kind of strength and confidence they thought was gone for good. And today, I'm going to share something that flips conventional advice on its head. These 5 simple stretches, done from your bed or living room floor, have helped thousands of men just like you experience longer-lasting, firmer erections and eliminate embarrassing leaks. This is not theory. This is science, motion, and the body's ability to heal. And if you stay with me, I'll show you the exact stretch I call the ringinger, the one that unlocks it all. Ready to take back control? Before we dive in, if you haven't subscribed yet, now's the perfect time. Tap that button and turn on the bell so you never miss practical, real-world tips designed to help you reclaim your strength, control, and confidence. And if this video speaks to you, type 1 in the comments. If it doesn't, type 0, and let me know how I can better serve you. All right, now that you know what's possible, let's get to work. We're starting with the first stretch, and trust me, it's more powerful than it looks. This movement begins unlocking tightness in your hips, one of the biggest hidden causes of weak erections and unexpected urine dribble. If you've been sitting for years in the office, behind the wheel, or at home, this is exactly where we need to begin. Let's ease into it together. 1. Hip opener windshield wipers. Let me take you back for a moment. A few years ago, I was working with a retired firefighter named Bill. Big guy, tough, had been through it all. Smoke, heat, collapsed lungs, you name it. But there he was in my office sitting across from me, eyes lowered, voice barely above a whisper. He said, "Doc, I can't get hard anymore. And when I pee, it doesn't stop clean. I feel humiliated." I'll never forget the look on his face. It wasn't just frustration, it was loss. The kind of loss most men don't talk about. The quiet kind that chips away at your confidence, bit by bit. And then I asked him the question that always surprises men. "Bill, how long do you sit during the day?" He paused, then laughed nervously. "Pretty much all day, Doc. I watch TV, do puzzles, maybe take a short walk to the mailbox." What I told him next is what I'll tell you now, because it changed everything for him. And it might for you, too. Your hips hold the key. Not your heart, not your hormones, your hips. The joint where your legs meet your pelvis is one of the most powerful but overlooked areas in the male body. It connects directly to the pelvic floor, which is the muscular system that supports your bladder and your erection. When your hips are tight, which they almost always are in older men who sit a lot, it puts a chokehold on the nerves and blood vessels that allow you to get and keep an erection. It also weakens your bladder control. That's why you leak a little after you stand up. That's why you get softer quicker, and that's why this first stretch is so important. The hip opener, or what I often call the windshield wiper, is your first step to waking these muscles up. And let me be clear, this is not some fancy yoga pose. This is functional medicine. It's about creating space where your body has been locked up for years. All you need is a place to sit. Your bed, a chair, the floor if it's comfortable, and a willingness to move slowly and breathe. Here's what you do. Sit with your knees bent, feet flat on the ground, about shoulder width apart. Support your upper body by leaning back on your hands, or against a wall if you prefer. Now, slowly, let both knees fall to one side, like windshield wipers sweeping across a rainy window. Pause. Then bring them back up and lower them to the other side. That's it. But don't let the simplicity fool you. Inside your hips, 1,000 little adjustments are happening. Your pelvis begins to rotate. Your inner thighs start to release. The deep muscles under your groin, the ones that control the base of your erection, start to wake up. You might feel a little stiffness or even hear a pop or crack. That's okay. Your body's realigning itself. You're loosening the noose. And here's the magic. As these muscles begin to move freely again, blood flow improves. Think about that. For an erection to be rock hard, you need pressure, blood pressure to enter and stay inside the chambers of your penis. If your hips are locked and your pelvic floor is weak, that pressure leaks. You get soft, you dribble urine, you lose control. But when the hips open and the pelvic floor is activated, your entire lower body begins to function the way it was meant to. Strong, stable, responsive. Bill practiced this stretch every morning and every night for just 40 seconds each time. Within 3 weeks, he told me he was waking up with morning wood again for the first time in years. Within 6, he wasn't leaking anymore. He even joked, "Doc, I think my wife's starting to look at me different again." And I believe him. When a man feels strong in his body again, it changes the way he walks into a room. You carry yourself differently when you're not worried about hiding a pad or wondering if tonight will be another letdown. So, as you do this first stretch, don't just go through the motions. Visualize what's happening inside. Feel the muscles slowly letting go. Picture the blood flowing freer, the nerves firing stronger, and the control returning to your body. You are not too old to feel alive again. Your body remembers strength. We're just helping it recall it. Now, here's where it gets even better. You've opened the door with this first stretch, but behind that door is something even more powerful. The next movement I'll show you doesn't just loosen muscles. It directly activates the core of your pelvic floor. It's the stretch that triggers a chain reaction throughout your lower body, setting the foundation for firmer erections and a bladder that holds tight when you need it to. Most men skip this one, and that's a big mistake. Stick with me, and I'll show you exactly how to do it right. Let's move on. If you're still here and these stretches are starting to make sense, for you, drop the number 1 in the comments to let me know you're with me on this journey. Now let's keep it going and move into stretch number 2. 2 Cobra Stretch Pelvic Floor Awakener. Years ago, I treated a man named Walter. He was 67, former Navy, proud, private, and stiff as a board. Both in posture and, as he joked, everywhere except where it mattered. He said to me, "Doc, I can't remember the last time I woke up hard, and I feel like I'm leaking more than I'm peeing these days." He had that look I've seen in so many men, a mix of frustration and quiet embarrassment. That kind of thing eats away at you. It's not just about sex or control, it's about dignity. So, I asked him a question I ask most of my patients. "When was the last time you stretched your belly?" He raised an eyebrow like I'd asked him something crazy, but I was dead serious. You see, the muscles in your lower abdomen, right below the belly button, wrap around and connect to the pelvic floor. And when you spend years hunched over, sitting in recliners, driving, watching TV, or leaning forward, those muscles tighten. And when they tighten, they tug at the pelvic floor like a stubborn knot. That knot chokes off blood flow. It deadens nerves. It puts pressure on the bladder. You don't feel as much. You don't perform as well. And you lose the clean stop at the end of a pee. What's worse is most men never even think about stretching this area, but Walter did. And you're about to. The Cobra Stretch is one of the most powerful tools I use in my clinic, especially for men over 60. It's gentle, grounded, and surprisingly effective at restoring what many think is permanently lost. When done right, it doesn't just loosen your belly, it activates deep pelvic connections that control both firmness and flow. To start, lie on your stomach. Take your time. You don't need to be graceful, just safe. Keep your legs long behind you, about shoulder width apart, toes relaxed. Place your hands under your shoulders like you're about to do a push-up. Now, gently press up with your arms and slowly lift your chest off the ground. Go only as high as feels comfortable. Your pelvis stays down, anchored. And here's the key. As you rise, look slightly upward and breathe deep. You'll feel the front of your body begin to stretch open, especially that tight lower belly. What's happening here isn't just surface level. As you lift, you're stretching the fascia, muscles, and connective tissue that run from your ribs down to your pubic bone. And right underneath that is where the magic happens. The blood vessels that feed the penis, the nerves that control sensation, and the pelvic sling that supports your bladder, they all pass through this region. The cobra doesn't just release pressure, it wakes up what's been dormant. It signals the body, hey, we're not done yet. We're still in the game. And it's not just about feeling better. When this area becomes more elastic and alive, erections become stronger, fuller, longer lasting, because the blood doesn't just arrive, it stays. And the leakage, that soft dribble you hate, it slows, then stops, because your muscles are finally able to close the valve the way they're supposed to. Walter called me after 3 weeks of doing the cobra every morning. He said, "Doc, I didn't expect this. I'm waking up hard again, and I don't need a towel in the bathroom anymore." That's the power of this stretch. It's not hype, it's biology doing what it was always meant to do. Now, if you're worried about getting down on the ground, let me reassure you, this can absolutely be done on a firm bed. You can even stack pillows under your chest if your back is sensitive. The point isn't how high you lift, it's that you breathe and feel the front of your body open up again. Go slow, stay with it. Let the stretch do the work. And while this one is subtle, don't underestimate it. I've seen it rekindle not just erections, but confidence. I've seen men walk differently, speak more firmly, even reconnect with partners who thought that chapter was closed. This stretch is about reclaiming space in your own body. And that kind of space, that kind of freedom, it ripples into every part of a man's life. But we're just getting started. Because the next stretch doesn't just loosen you up, it gets into the deepest parts of your groin. It's a circular motion that stirs things awake like oiling a rusty engine. And it just might be the stretch that makes you feel 20 years younger down there. Don't go anywhere. You're going to want to feel this one. 3. Stir the pot. Groin release. Let me tell you something I've learned after 3 decades working with older men. What you think is just aging is often just a matter of stiffness and neglect, not intentional neglect. No, just that no one ever taught us what to pay attention to. Take the groin, for example. Most men only notice it when it's in pain or when it's failing them. But the truth is, it's one of the most powerful hubs of the male body. And when you learn how to release it, really release it, you unlock a kind of strength and sensitivity you forgot you even had. I once worked with a man named Carl, 72, divorced former car mechanic. He was quiet, polite, but clearly frustrated. "Doc," he said to me one day, "it's like the engine's still running, but I've lost power to the wheels." What he meant, of course, was he still had desire, still had the urge, but the physical response, it just wasn't there. On top of that, he'd started leaking a little when he coughed or stood up too fast. And in his words, it was killing what was left of my confidence. Carl had never stretched a day in his life. His hips were tight, lower back stiff, and when I asked about his inner thighs, he just blinked. That's when I introduced him to this stretch. Stir the pot sounds simple, but it's one of the most effective tools we have to unlock the groin, the very area where blood flow, nerve signals, and muscular control for erections and urination all intersect. To begin, you lie on your back, knees bent, and gently bring them toward your chest. Wrap your arms around the outsides of your knees and slowly begin to move them in a wide circular motion. Imagine you're stirring a big pot with your knees. Wide, slow, and smooth. What you're doing here isn't just moving your legs. You're stretching the adductors, the inner thigh muscles that attach directly to your pelvis and influence the pelvic floor. When those muscles are tight, they limit movement, restrict blood flow, and put pressure on your bladder and erectile tissues. But as you move in circles, something beautiful begins to happen. The deep tension in your groin starts to melt. That tug you didn't even know was there begins to ease, and as you move, blood starts to flow more freely, not just anywhere, but to the exact areas that support hardness and control. The stretch softens the inner walls of the pelvis and creates space for blood vessels to expand, for nerves to wake up. And for a man like Carl, that was the first time in years he felt something come back online. After about 2 weeks of daily practice, Carl told me he felt more alive in his groin. By the 3rd week, he stopped needing to wear extra protection in his underwear. And one day, He walked into my office and said, "Doc, I don't want to jinx it, but I woke up hard. I haven't said that in years." And I believed him because I see it all the time. There's a profound connection between how we move and how we perform. And this stretch is about more than motion. It's about identity. It's about reminding the body that you're not done yet. That strength, firmness, and control are still yours, buried just beneath a little rust. Now, a few tips. Breathe while you do this. Deep in through the nose, out through the mouth. As you move your knees, let your hips follow naturally. The wider the circle, the deeper the release. Don't force it. Let your body guide the movement. Some men feel a warm sensation in the groin. Good. Some feel a little emotional. Also good. Let it come. This is healing. This is you returning to yourself. Stirring the pot is like oiling a dry engine. You're not forcing performance. You're preparing it, making way for it. And over time, it starts to return. You'll notice firmer morning wood. You'll go longer between bathroom trips. And most importantly, you'll begin to trust your body again. That trust, that's everything. So, if you've been feeling disconnected, numb, or just not like yourself down there, this stretch is your bridge back. And it's not about perfection, it's about consistency. Just 40 seconds a day, and you begin to restore one of the most important systems in your body. But hold on, because what's coming next is where things start to get deep. Literally. The next stretch pulls you further into the pelvic floor than anything we've done so far. It targets the very muscles that form the base of your core. Muscles responsible for your bladder control, your orgasm strength, and the ability to hold an erection without fading too soon. This one hits where it matters. Don't go anywhere. You're going to want to feel this next stretch from the inside out. If you're still watching and these stretches are resonating with you, go ahead and comment the number 1 below, just so I know you're still here and committed. Now, let's keep moving forward with stretch number 4. 4. Knees to chest, bladder reset. There's something deeply humbling about the moment a man admits he no longer feels in control of his own body. I remember one patient in particular, George, 69, retired truck driver, hands like baseball mitts, voice rough from decades on the road. He came to me not because of pain, but because of shame. He said, "I never thought I'd be the kind of man who pees a little after standing up. My body used to be dependable. Now I don't trust it." That hit me hard because George isn't alone. Many men carry that same quiet frustration, embarrassed not just by the inconvenience, but by what it symbolizes, the slow fading of manhood. What George didn't know, and what most men don't, is that our pelvic floor isn't a fixed thing. It's not a one-and-done muscle group. It's responsive. It can weaken, yes, but it can also wake back up. And one of the simplest ways to do that, especially when leakage is part of the picture, is the knees to chest stretch. It's basic, even childlike, but it's also incredibly powerful. This stretch helps restore something most of us haven't felt in years: total release. That deep inner relaxation that comes when tension finally lets go and blood flow returns to the parts of your body that need it most. To begin, lie flat on your back. Let your head rest on a pillow if that feels good. Then bring both knees up toward your chest, just like we did with the previous stretch. But this time, instead of stirring in circles, you simply hold. Wrap your arms over the tops of your knees, not under. And here's where the work begins. Not in motion, but in stillness. You gently pull the knees apart, creating space through the hips and groin. And hold. You'll feel a stretch deep in the inner thighs, but also, if you're paying attention, a subtle pressure at the base of your pelvis. That's the floor we're after. That's where the change starts. As you breathe, your body does something extraordinary. The nervous system begins to downshift. The muscles in your lower belly and perineum start to soften. And in that softening, something critical happens. Blood vessels begin to open. Nerves come alive. The tissues responsible for maintaining an erection. Those chambers that need to expand and hold pressure are finally getting the circulation they've been missing. At the same time, this stretch retrains the muscular sling that controls urination. You're not just stretching, you're rewiring. Your brain is learning once again how to tell your pelvic floor, hold tight until we're done. And over time, that translates to no more dribble, no more rushing to the bathroom, and no more second-guessing yourself in the middle of the night. George practiced this stretch every evening before bed. At first, he said it felt awkward, but by like I was doing yoga in slow motion, he joked. But he stuck with it. He told me within 2 weeks he noticed he could sleep through the night without waking to pee. And a few days after that, he called and said, "Doc, I didn't just wake up dry. I woke up hard, and I hadn't done that in 5 years." His voice cracked when he said it, and mine nearly did too. Because the truth is, it's never just about the body. It's about what the body represents. When you start to gain control again, when your erections return and your bladder behaves, you stop feeling like you're just managing decline. You feel alive. And that sense of vitality changes everything: your posture, your energy, even the way you look at yourself in the mirror. So, as you hold this position, knees to chest, arms pulling gently, breath steady, know that you're doing more than stretching. You're restoring the relationship between mind and muscle. You're rebuilding trust in your own foundation. And yes, it's simple. But sometimes simple is exactly what works. Let go of the idea that strength only comes from strain. In this moment of stillness, your body is doing some of its deepest healing. This is how we prime the system. We open the hips, we activate the groin, and now we reset the floor. We remind it of its job, and it begins to remember. But we're not finished yet, because the final stretch I'm about to show you is what ties it all together. It's the most challenging, yes, but also the most rewarding. I call it the ringer for a reason. It gets right into the base of your body, deep into the pelvic bowl, and wakes up the parts most men think are lost for good. If you've been waiting for the one stretch that brings it all home, the one that can truly transform the way you perform and feel from the inside out, this next one is it. Stick with me. You're about to unlock something powerful. 5. Happy baby, the ringer. I've saved the best and most challenging for last, but don't let that scare you. The happy baby stretch, or as I like to call it, the ring dinger, is where everything you've done so far comes together. This is the moment where you stop just loosening up and start unlocking something deep, something powerful, something most men haven't felt in years. I remember a man named Harold, 74, a retired elementary school principal. His body had stiffened over the years from long hours sitting, commuting, and managing stress. He told me, "Doc, it's like my body is still here, but I've lost touch with it. I feel numb down there, like my manhood is disconnected from the rest of me." That comment stayed with me because it wasn't about sex. It was about identity, confidence, connection. So, I taught him this final stretch, and the shift I witnessed in Harold physically and emotionally was nothing short of remarkable. The happy baby is unlike any of the other movements. It's not just a stretch. It's a full body opening that reaches down into the base of the pelvis, activating the very root of your sexual and urinary function. When done correctly and consistently, it restores space, sensation, and strength in the places you need it most. You start by lying on your back. Gently bring your knees up toward your chest, and then let them drift apart. From there, you reach your hands through the inside of your thighs and grab the outer edges of your feet. Don't worry if you can't quite reach. Use a towel or belt if needed. The key is to get your feet pointing toward the ceiling while keeping your back relaxed against the floor. Then, using your arms, gently pull your knees down toward your armpits. You'll feel the stretch deep inside your hips, your inner thighs, and more importantly, through the pelvic floor itself. This position may feel strange at first, especially if your body hasn't moved like this in decades. That's okay. Take your time, breathe, because this movement is doing more than stretching. It's opening blood flow into the erectile chambers, waking up the perineum, that powerful space between the testicles and the anus, and re-engaging the sling of muscles that support your bladder and sexual response. Now, I want you to imagine something as you breathe into this position. Picture the base of your pelvis like a ring, a circle of muscle and connective tissue that holds everything together. When that ring is tight, blood flow gets cut short. Erections feel soft or inconsistent, and you lose control after urinating. But when that ring opens and strengthens, the opposite happens. Blood flows freely and stays. You feel pressure build and hold. Urine stops cleanly and completely. This isn't just theory. It's what I've seen over and over again in men who give this stretch the respect and consistency it deserves. Harold practiced Happy Baby every night before bed. At first, it was difficult. His hips trembled, his groin ached. But I reminded him healing isn't always comfortable. It's movement with purpose. Within 3 weeks, he told me he felt like something had switched on inside his body. He wasn't just getting firmer erections, he was getting them faster with less effort. The leakage he had dealt with quietly for years gone. But what really got me was the day he said, "I don't feel numb anymore. I feel like me again." That's the kind of transformation this final stretch can bring. You might feel vulnerable in this position. You might feel resistance. That's normal. This stretch pulls you open from the very place we as men tend to protect and hold tension. But that's also why it works. It forces you to release. And in that release, strength returns. Stick with it. Even if it's not perfect, even if it feels awkward, your body is listening. Every second you spend in this stretch, you are reactivating the exact structures that control how strong, how hard, and how long your erections can be, and whether your bladder finishes the job without leaving you wet or worried. Now that we've gone through all 5 stretches, you may already feel the shift. Maybe your hips feel looser. Maybe your core feels lighter. Maybe there's even a sense of warmth or energy building in your lower body that hasn't been there in years. That's the beginning. That's your body remembering. But these 5 stretches are only the start. In the conclusion, I'm going to show you how to build these into a daily ritual, how to get the most from them, and what to expect in the days and weeks ahead. Because what's coming next is the plan to make these results stick. And that's where everything changes. Conclusion. If you've made it this far, I want to take a moment and speak to you, not just as a doctor, but as a man who understands what it means to feel like your body is slipping away from you. The truth is, most of us were never taught how to care for these deeper parts of ourselves. We were taught to be tough, to power through, to keep quiet. But no one ever handed us a map for what to do when the power starts fading from places we thought would always be strong. Our bladder, our erections, our sense of pride. That silence. It's cost too many men too much. And that's why I made this guide. Not just to give you stretches, but to give you back something you may not have realized you lost. Ownership of your own body. Let's quickly revisit what you've done here. You began with the hip opener, a simple but mighty stretch that loosened the gateway to your pelvis. That movement alone started the process of restoring blood flow and releasing pressure where it had built up silently over years. Then you moved into the cobra, stretching the deep lower abdomen and waking up muscles that had gone quiet, reconnecting you to your center and restoring the foundation for better erections and bladder control. From there, you stirred the pot, literally freeing your groin, unlocking your adductors, and helping the nerves and vessels that support sexual function finally breathe again. Then you brought your knees to your chest, resetting the pelvic floor in stillness, gently retraining your body to remember how to stop the dribble and hold firmness where it counts. And finally, the ringer, Happy Baby, a full-body, deep release that reconnected your brain, your breath, and your masculinity at the most primal level. These weren't just stretches. They were signals, messages to your body that you're not giving up, that you still care, that you still want to feel alive and whole. And that matters more than you know. I've seen men in their 60s, 70s, and even 80s take these exact steps and rebuild what they thought was lost for good. I've watched eyes light up when they share that they woke up hard for the first time in years. I've seen shoulders square again when they realize they no longer need a pad in their underwear or a second trip to the bathroom just to finish peeing. I've even had wives call to thank me, not because I gave their husbands some magic pill, but because they saw a man start to believe in himself again. I want you to understand something very clearly. This isn't about perfection. It's not about flexibility or how far you can stretch. It's about consistency. It's about doing the work quietly, steadily daily. These 5 movements done in under 10 minutes a day have the power to radically shift how you feel, how you function, and how you see yourself. You don't need fancy equipment. You don't need anyone watching. All you need is a little space, a little time, and a willingness to show up for yourself, even if it's been a while. I know life can be hard. I know aging can feel like a slow erosion of things you used to count on. But I also know this. It's never too late to start turning things around. Your muscles still respond. Your nerves still remember. Your blood vessels are waiting for permission to open up and flow again. You are not broken. You are not finished. You are simply being invited to reconnect with the part of yourself that was never gone, only asleep. So here's what I ask you to do. Start today. Commit to 7 days of these 5 stretches. Give your body the chance to respond. Watch what happens. Notice the little things, the firmness, the confidence, the comfort in your own skin. And when you do, remind yourself this didn't come from a bottle or a surgery. It came from you, from the time you took, from the care you gave. That's real strength. That's lasting change. And if you're feeling inspired, I want you to know this is just the beginning. There's more I can teach you about breathing, about strengthening, about nutrition, and mindset, all designed to help you not just regain what you've lost, but to move forward with pride and power. Because this chapter of life isn't the end. It's a new kind of beginning, one where you get to decide what kind of man you want to be from here on out. Thank you for trusting me, for listening, and for showing up for yourself. I believe in you. Now go put this into action and watch your life change from the inside out. If this video helped you, even just a little, don't keep it to yourself. Hit that like button, share it with another man who needs to hear this, and leave a comment below to let me know how you're feeling after trying these stretches. Your story might be exactly what another man needs to find his strength again. Let's keep this conversation going together.